The anterior tibialis and the posterior tibialis are physically located more on the lateral side of the leg, but they function more as if they were on the medial side because of the way their tendons cross the lower leg superior to the ankle joint. You can see that both of them, they cross superior to the ankle joint and have their insertion in the foot on the medial side of the foot. And this should make sense. If the tendon is crossing over here, then really when the muscle pulls, because we know that muscles only pull and don't push, it's going to pull this part, the medial part of the foot, this way, kind of just as if the muscle were right here, as if the muscles were over here and went straight down and pulled on that same side. So even though the tibialis muscles are actually located kind of more on the lateral side physically, they have an effect as if they were on the medial side. And that goes for the anterior and the posterior tibialis. The posterior tibialis, we can see the same thing. It's physically located kind of on the lateral side, but it crosses the ankle joint and then has its insertion in the foot on the medial side of the foot. So an easy way to remember these muscles is that the tibia is the medial of the two leg bones. So the fibula is lateral, the tibia is medial. So the anterior and posterior tibialis muscles are functionally on the medial side of the leg. And then naturally, the anterior tibialis attaches anteriorly, so it's going to function in dorsiflexion, and the posterior tibialis attaches posteriorly, so it's going to function in plantar flexion, and then they're both going to function in supination as well. So they both supinate, the anterior tibialis dorsiflexes, and the posterior tibialis plantar flexes.